Hello. All right, looks like I'm live. I'm gonna go ahead and share this to my personal page. If I can figure out how. Here we go. Okay, so I have posted on my own personal page now. I think I'll just probably go ahead and get started, just hop right into it today. If people join along the way, I will greet you all. So, if anybody doesn't know me, my name is Dr. Sarah Ponica, and I work here at Get Well Family Chiropractic in Florissant, Missouri. I work with Dr. Robin Lawrence, and she is normally here next to me during our Facebook Live classes, but this week I will be presenting the class on my own. So I just wanted to thank anybody who is watching tonight for just taking some time out of your busy evening to come hang out with me, as I'm going to be here tonight talking about knee pain. And so, like I just said, I'll be talking about knee pain tonight, and some ways that we can kind of relieve that pain and some ways to prevent it. So if you have knee pain, or if you know anybody that has it, go ahead and share this video to your Facebook page, or send it to any friends that you know that might have knee pain and been complaining about their knee hurting, and have them come hang out with us too. This is going to be as interactive as people make it, so if people want to write in the comments, the more the merrier. So if you have any questions or comments or anything like that, feel free to share those along the way. And let's get started. Hello, Matt. Thanks for watching. Okay, so before we can talk about knee pain, we are going to talk a little bit about our knees. So the knee is the largest joint in the human body, and it experiences a lot of wear and tear. And before we start talking about ways to treat and prevent knee pain, we're going to take some time to explore how your knees are structured. And so if you guys want to go ahead and share in the comments your answer to this question, on a scale of 1 to 10, how confident do you feel in your knowledge of the structure of the knee? Okay, so we'll start by just talking a little bit about bones and tissues of our knee. So the knee is going to be comprised of 4 different bones, and I actually have a picture here on the next slide, so that'll be a good visual aid for you here. So the first bone is our thigh bone. All right, Matt thinks he knows 7 out of 10 about knees, so we'll see how how much you really knew after all this. Okay, so our knees are comprised of 4 different bones, and the thigh bone, which is our femur, which is that just long bone in your leg, that's going to be at the top of that knee joint. And then the 2 lower bones, which are the tibia and the fibula, and those are the bones of your lower leg, and those make up the lower part of that knee joint. So your tibia is going to be like your shin bone, and then your fibula kind of hangs out on the side there. And then on the top of our knee, a 4th bone called the patella, which we also know of as the kneecap, slides into a shallow groove there. And then 4 rubber band-like pieces of flexible, stretchy connective tissue connect our femur up here to the tibia here and help hold the knee bones together to create a movable, hinge-like structure that rotates as it bends. And because of the knee's unique ability to rotate and bend, not just bend like a hinge, the knee is actually known as a swivel joint. So I'm going to go ahead and share a link in the comments that's going to take you to some different diagrams and stuff like that. And there it actually has the pictures that I'm showing you here. And you can look at that now or later, and it will just show you that anatomy of the knee. So let me just share that real quick. Oh, come on. Alright, so I've shared that link there now. And moving along. Alright, so next I'm going to tell you a little bit about tendons of your knee. So some of the major structures that make up our knee include tendons, which is going to be a fibrous band of tissue that connects muscles to bones typically. So we have 2 major tendons in our knee joint, and that's going to be the quadriceps tendon, which is up here, and then that connects the long quadriceps muscles in our thigh to the patella, which is your kneecap, and then we also have the patellar tendon, which is going to connect the patella to the tibia. And so like I said, tendons normally connect muscle to bone, but this is a very rare situation where a tendon, the patellar tendon, connects a bone to a bone. And the reason it's called a tendon here instead of what you'll see is a ligament is because instead of helping with structural integrity, it's actually helping with movement of the knee. And so both the quadriceps tendon and the patellar tendon help you to strengthen or to straighten your leg, or what we call extend your knee. Okay, so now moving on to ligaments. So ligaments are connective tissues that connect bone to bone, like I just said. So ligaments in the knee connect the femur, which is that top thigh bone, to the tibia, which is our shin bone, and include the following. So we're going to have the ACL, which is the anterior cruciate ligament, and that's going to be located in the center of our knee here. And that controls rotation and forward movement of the shin bone, of the tibia there. And it's shaped like a cross, the ACL is, and it's the most likely ligament to get torn or injured. So I'm sure you've heard of people getting ACL injuries in sports. And then we also have the PCL, which is our posterior cruciate ligament. You can see it on the diagram here. It is also located in the center of our knee, and it controls the backwards motion of the shin bone, the tibia. And then we have the MCL, which is the medial collateral ligament. It's called that because it is here on the inside of your knee, the medial side, and it provides stability to the inner knee there. And then we also have the LCL, which is the lateral collateral ligament, and it is like the MCL, but it provides that stability to the outer knee. We also have structures in our knees called menisci, or you've probably heard the word meniscus. That's the singular form of that word. We have a medial and a lateral meniscus, and those are both sitting on the top of our tibia, that shin bone, and those are thick pieces of cartilage, and they're there to absorb any shock and just provide for a smooth movement of our knee joint when we're walking and doing other activities. So here is a picture of more of just the meniscus, so it kind of shows with the femur not sitting on top there, you can really see what that cartilage looks like. And let me know if anyone has any questions along the way. All right, so now you know a little bit about the structure of our knee, the different kinds of tissues that make it up, that whole joint. So now we're going to dig a little bit into knee pain. So knee pain is a very common complaint among people of all ages, and it can start becoming bothersome due to a variety of different reasons. We see knee pain all the time here in the chiropractic office. So the most common causes of knee pain can include inflammation caused by improper lifting of heavy objects, poor flexibility, bad shoes, muscle weakness, pushing yourself too far with high-impact fitness routines, and structural knee problems like arthritis when we're getting a little older, and then maybe like torn cartilage or ligament damage. So if anybody watching is currently dealing with any knee pain, let us know in the comments if you know what's causing it, if you have maybe gotten a diagnosis for what's causing your knee pain. Okay. Here is a common question that we get at the office, and that a lot of people are wondering when they start to get knee pain. Do I need surgery for this? Do I need a knee replacement or some other kind of surgery? So generally, people who are suffering from inflammation-related knee pain can actually heal without having to resort to that surgery. Those who are dealing with less serious inflammation issues will be able to extend their knee, straighten their leg without any pain. But on the other hand, people who have structural damage to maybe one of those tendons, ligaments that we talked about might have a lot of trouble bending and straightening their knees. So your medical specialist, if you're going to an orthopedist or physical therapist or a chiropractor, they will help you to determine the seriousness of that knee injury. And like I just said, we as chiropractors are trained to know certain tests that we can do to help us to diagnose which tissues around your knee might be causing that knee pain. So if you've been told by another medical professional that you need surgery or some other treatment that you think might be too drastic, don't be afraid to get a second opinion. We are always here at the office here at Get Well Family Chiropractic to discuss your options for what you can do about your knee pain. So feel free to call out to the office and make an appointment if you need any help with your knee pain. Okay, this is a really big and important one too. So you might assume that if you're having some knee pain, the best thing to do for your knee is to just let it rest. And that, my knee hurts so bad, every time I walk on it, it hurts more. This might not always be the case, to just let it rest being the best thing. Staying active helps control our weight and helps us build muscle. And both of these things can really help protect your knees from further damage. So if you're living with arthritis in your knees, strength training that focuses on building muscles in the quads, which are, our muscles, our big muscles in the front of our thighs, and then our hamstrings in the back of our thighs. Muscle building exercises in those places can decrease pain and help you to better tolerate your knee pain. You can also opt for non-impact aerobic exercises like walking on level ground, using an elliptical machine that's going to take a little bit of pressure off the knees, using a stationary bike, or swimming laps, or even just kind of walking around in a pool to give you that extra buoyancy. These, are exercises that are going to be a lot better than just sitting around and not moving your knee at all. And it might be a good idea to avoid activities that put extra stress on the knees, like kneeling, deep knee bend kind of exercises, and downhill running. So let us know in the comments, how do you stay active if you have knee pain? Because that might help some other people that have knee pain. Hello, Marlene. Thank you for watching. And your husband, Don, has had osteoarthritis. And is that in his knee? Okay. So stretching and warming up, both important. Stretches that focus on our hamstrings, which are those big muscles in the back of our thigh, like I said, and then the quads, which are in the front of our thighs, take the pressure off of our knees and our kneecaps. And people who skip the stretching or don't consider it as a necessary part of their workout routine are missing out on all of the protection that a flexible body can offer. Warming up your muscles also before diving into any physical activity can also prevent any injury. If you're not into stretching, at the very least, you should start your activity at a slower pace before working up to that full velocity. So for example, you can walk or jog slowly for the first 10 minutes of your run. Just don't go all out into it. Or you can start by lifting a few rounds using 75% of the weight that you plan to lift in your actual strength training workout. Marlene, walking and running. So he does have osteoarthritis in his knee, and so I think this class will help him. Okay. Alrighty. So now I am going to tell you guys a few different specific exercises and stretches that can get those specific muscles that I've been talking about, to be able to support your knees and get it well conditioned. So the first exercise I'm going to tell you about, and I thought about maybe demonstrating them, but I don't know if I really have the space here. Now, the first one is step-ups. So you're going to stand in front of a small step or stool. I know I have just aerobic steps that you can put on the floor. And then you're just going to lift your body onto the step using one leg. So step up, let's say with your right leg, and then you're going to step backwards down the step with the same leg. So you step up, up, down, down. And you can do that 10 to 15 times per leg. Then next we have hamstring curls. So for this, you would lie on your stomach with your legs straight, and your head is going to be resting on your arms or just on the ground. So we're face down here, like I said. So you're going to bend one leg with your heel towards your buttock, and that's the exercise. So you're just bending that knee, bending that heel towards your butt. And that's going to be repeated 10 to 15 times, and then switch legs. So those are the hamstring curls. And then we are going to have straight leg lifts. So on this one, you are lying on your back with one knee bent at 90-degree angle and that foot on the ground. So you have one knee bent, foot on the ground, and then the other leg is going to be straight, and you're going to lift it up off the ground and then bring it back down. So that's the straight leg lift. You'll repeat that 10 to 15 times and then switch legs. And I'm going to post these descriptions of these exercises in the comments as well. Next, we have the butterfly stretch. I'm sure a lot of you already know what this is too. So you're going to sit up straight with the soles of your feet pressed together. So your legs are like this and your feet are together. So you're going to hold your feet and you're going to slowly lean your upper body forward, keeping your back straight, and then you just hold that stretch for 30 seconds to a minute. And then the last one I have for you here is the standing hip flexor stretch. So for this one, you're going to get into a stride position. So your body and feet are going to be facing forward with one foot stepped further in front than the other. And then you're going to stand up straight with your abdominal muscles tighten that core. And you're going to keep your back straight. You're going to slowly lunge forward with the front leg. And then just hold that stretch for 30 seconds. And for this one, you are working the back leg hip flexor. So I know you can't really see this, but my left leg is forward, right leg is back. You're just leaning into it, and you are stretching that muscle there. So you can hold that stretch for 30 seconds to a minute, and then switch legs there. And I will share those exercises. If anybody has any questions or anything, let me know in the comments. Okay, there, I just shared those exercises. Okay. All right, so extra body weight has a really big impact on the stress that you put on all of your joints, and this includes our knees. It really includes our knees a lot. It has been found that people who are overweight and have arthritic knee pain can lose about 20% of their pain with every 10 pounds of weight loss. Like, imagine that. All right, and wearing the right shoes. So wearing supportive and comfortable shoes plays a significant role in taking the pressure off of those knee joints and promoting proper leg alignment and balance. For the ladies out there, when you're wearing high heels, like we see on the picture here, your weight-bearing line tips forward. So your quadriceps, which are, like we said, those front thigh muscles, have to work harder to hold your knees straight, which then leads to knee pain. But if your heel is closer to the floor in low pumps or flats, then your thigh muscles don't have to work as hard to maintain stability, which is going to be easier on the knees. And for exercise shoes, you're going to want to find good quality sneakers and get professionally fitted by someone at a running store or a sporting goods store. And you can also ask about shoe recommendations specifically for knee conditions. You'll be surprised at how far this tennis shoe technology has really come. And could you ever imagine that working our core could be tied into our knees? Who knew? Having strong core muscles, which is in your abdomen here, your abs, but also in your lower back, that's also all included in the core. That will help promote good posture, and in turn, this is going to lessen the pressure on your knees. Exercises like planks and back extensions can help strengthen our core, along with a lot of other ones, but if you want to keep the basics starting out, planks, you are going to lie face down with your toes pointed to the floor, put your forearms on the floor with your elbows at 90-degree angles, and then you're going to tighten your abdominal and gluteal muscles and just lift your body off the floor. You want to keep your back straight and hold this for really as long as you can, but on here we're saying 15 to 45 seconds. And then back extensions, you're lying face down, elbows are bent, hands on the floor, and you're going to keep your hips on the floor and just lift your head and shoulders and your arms. And you want to hold up for 5 to 10 seconds and then come back down and repeat that 5 to 10 times. So, switching gears a little bit here, something else that you can try is Tai Chi. Tai Chi is an ancient physical and spiritual practice offering many benefits. The practice can increase range of motion in all of our joints, help with balance and flexibility, and it strengthens our joints and surrounding muscles through low impact movements, which is going to be good for people who are having knee pain from inflammation and things like that, because those high impact exercises are going to make your knees hurt worse. So in a study published by Arthritis and Rheumatism, researchers found that practicing Tai Chi is especially beneficial for people with osteoarthritis. So Merlene, maybe you guys can try some Tai Chi. Yoga. Yoga is really versatile enough that anyone and everyone can use it in their health and wellness routine. You can try looking for a yoga routine specific to helping with knee pain, or try a few classes and then let the teacher know that you're struggling with knee pain, and they will provide you with a modified routine. Okay. Get a massage. So by enhancing our blood flow and circulation through massage, this is going to relax the muscle tissue and soothe any inflammation that's going on. And over time, this can help ease joint stiffness and increase the range of motion of our joints in any individual suffering from arthritis, fibromyalgia, and osteoporosis. You can also visit a chiropractor. I like this one. Chiropractic adjustments can help sore knees and are most effective when they're combined with complementary corrective exercise. So knee pain is commonly going to be caused by muscle imbalances and structural misalignments around the hip, knee, and ankle joints, which is going to be brought on by poor posture, overuse, and repetitive stress, and physical trauma sometimes. So chiropractic adjustments of our hips, our spine, and that patellofemoral joint, which is one of the joints in our knee, can help to mobilize the joints, get them back into proper alignment, just to keep our whole body in alignment. And this can alleviate our joint stress. It can reduce inflammation and facilitate healing of the joint and the surrounding soft tissue. So, can't go wrong here. So when the chiropractic adjustments are combined then with corrective exercises that complement and reinforce your adjustments, this treatment can definitely be very effective. Another thing you can try is acupuncture. It's definitely going to be worth a shot to help with knee pain if you haven't tried it. This ancient practice has been around for millennia, and it has really stayed popular for a reason. So by activating the body's natural pain relief system and stimulating the nerves, muscles, and connective tissues, acupuncture can provide relief for our achy joints. Just make sure that if you go to an acupuncturist, they are certified by the National Certification Commission for Acupuncture and Oriental Medicine, NCCAOM. And sometimes it's about trying out heat versus ice on your knee. For the first 24 to 72 hours after a new knee injury, it's a really good idea to use a cold pack, to use ice here, to ease that swelling and the pain that's going to be there. So you can wrap an ice pack in a towel so that it doesn't directly touch your skin, and use it for about 15 to 20 minutes, and then do that 3 to 4 times a day. And then after the first few days of a knee injury, I would recommend switching over to contrast therapy. And for this, you will use a heat pack for 10 minutes. And then right after that, you're going to use ice for 10 minutes. And then right after that, you're going to go back to heat for another 10 minutes. So you can do this procedure here about 3 to 4 times a day again. And the heat that you use can either be like a heating pad, or you can use a warm towel, or a warm soak in the tub. So the most popular supplements for arthritis knee pain are chondroitin and glucosamine. Both of these substances are found naturally in our body, and chondroitin sulfate helps to keep cartilage from deteriorating. So, as we get older, our body doesn't make these as readily, so that's why it's good to get them as a supplement. And glucosamine is going to stimulate cartilage formation and repair, which is very important. So there's a lot of evidence that these work, but only in a certain percentage of patients. So they don't always work for everybody. Other supplements that have been shown to reduce inflammation in general are going to be turmeric, or the curcumin, fish oil, and ginger. You might also consider incorporating a multivitamin into your routine if you're not taking one. These vitamins and minerals are going to help enhance healing and recovery, just in general. And just keep in mind that when you're taking new supplements usually take about 4 weeks of regular use before you really notice any dramatic difference in how you feel. So don't give up if you take something for a week and don't notice a big difference. So something else you can try here, which you might not have thought would help with your knee pain, is going to be to switch up your diet a little bit. Food is medicine, as we know, so create a diet that helps to reduce inflammation, which inflammation is one of the biggest problems here with knee pain. So if you want to reduce our inflammation, you can choose whole grain starches, fresh whole fruits, and vegetables. You're going to consume fruits and vegetables in copious amounts and eat a variety of colors. Limit refined starches and sugars like white bread, soda, candy, and energy drinks. We don't want those. And choose lean proteins like chicken, turkey, fish, eggs, beans, and fat-free Greek yogurt. You want to actually limit your high-fat red meats like burgers, bacon, and sausage, and also processed meats like bologna, salami, hot dogs, and lunch meat. And then eat your omega-3s by incorporating more olive oil, avocados, nuts, salmon, tuna, and flax seeds into your diet. All right, so if something terrible happens and you hurt your knee, don't be shy about using a walking aid. A crutch or cane might be annoying to walk around with, but it will definitely take the stress off of your knees and help you heal faster if you do something that, can't really is a big injury. A splint or brace might also keep you stable in these situations when that inflammation is taking over. And you should definitely inquire with your health specialist to see what's best for you in this situation. All right, so that is all the information that I have for you all today. If you're interested in any of the sources that were used to put this class together, just let me know and I can send them your way. Just want to thank you guys again for taking the time out of your busy day to join this class. I loved getting to chat with you guys and hope that you all learned something valuable today about knee pain. If you have any other further questions or comments, anything to say, go ahead and post them in the comments or reach out to us directly. And yeah, thanks again. So, I hope you guys will be able to join us again next week for our next Facebook Live class. And it's going to be the art of tidying up. So I'm kind of excited about this one. We know this is straying a little bit from the topics that we normally talk about related to health, but a tidy home definitely leads to lower stress levels, which is part of living a more healthy, balanced life. So this class is going to be next week, same time, same place, July 28th at 6:15, right here on the Get Well Family Chiropractic Facebook page. Head on over to the event page for next week and hit interested or going if you think that you might like that topic. And thanks again for joining me tonight, and I hope you guys all have a great night. Okay. And Merlene, I believe the exercises were shared in the comments. It says knee stability conditioning exercises, and then has a big list of them there. Okay. Oh, and yes, I said the wrong date. Thank you for that too, Merlene. So it's going to be July 21st, next week, 6:15, right here on this page. All right. Have a great night, everyone.